Can you see?
Okay. Hello everyone, thank you for gathering with me today. My name is Shelby Franklin and I recently just started a career in the dental field. I came across a study that was done by Colgate Toothpaste. It said that 80% of the population chooses to not brush their teeth. To me, this number seemed a little bit low. Now, I can bet that almost all of you in this room also believe that flossing seems a bit overrated. Well, as someone that harasses people for a living about brushing and flossing their teeth, I can also agree that flossing is a bit overrated, at least the recommended once daily. But many health risks prove it to be a necessity to dental hygiene. I work with many patients every day and I see more and more people coming into the office with cavities that are in between each tooth more often than any other area. This is because your toothbrush cannot effectively reach in between each tooth like your floss does for you. Now, let me paint a little picture for you. The foods that you eat contain particles that stick to your teeth. If these particles are left on your teeth for too long, they begin to create their own bacteria. This bacteria is a sticky, white, chalky matter that we call plaque. Plaque can be removed from your teeth with a toothbrush and floss. However, if it is left on your tooth for more than a day, it begins to harden and turn into what we call calculus or tartar. Calculus buildup is not a huge health risk as long as you are consistent with seeing your dental hygienist at least 6 months out of the year. It is their job to then restore or to remove the calculus and restore it back to a healthy state. Now, if you are one of the people that chooses to never floss or uses excuses such as you don't have time, let me inform you on some of the health risks you're taking by never flossing. Now, the food that is left on your teeth contains particles that are sticking to them. It creates a bacteria, and this bacteria then creates its own acid. This acid will break down and eat away at the enamel of your teeth, which is the outermost surface of your tooth. If you are diagnosed with cavities or tooth decay, you are scheduling yourself an appointment with your dentist to have it drilled out of your tooth and restored. This also means money out of your pocket that could be better spent elsewhere. Now, me, along with, I'm sure, all of you, have seen your gums start to bleed when you were flossing at some point in your life. Flossing prevents one of the most painful mouth diseases, which is gum disease, or also known as gingivitis. Bleeding, redness, irritation, and inflammation are all signs of gum disease. Now, when you choose to floss on just an occasion, you are cleaning your gum tissue, making them healthier and cleaner. If you, however, neglect to floss your teeth, you are allowing your gums to become inflamed and enlarged, which leads me to my last risk. If your pockets, or if your gums around each tooth become too enlarged, they form pockets. If your pockets become too large, your teeth become mobile. This is also opening up new areas for your teeth, around your teeth, for bacteria to enter and cause infection. With these two things combined, you're allowing the worst thing that could happen in dentistry, which is tooth loss. If you lose any of your teeth other than your wisdom teeth, your entire bite is affected as a whole. Now, all of your teeth, except your wisdom teeth, must be replaced. Unfortunately, these procedures are the most expensive and anxiety-ridden procedures in dentistry. These 3 risks are the most common diagnosed health risks every day that I see in the office. However, there are many more that are diagnosed on a daily basis, but I think you get the idea of it. Tooth decay, gum disease, and tooth loss are all extremely painful and uncomfortable issues to deal with. Why would you spend your money and time on something that can be avoided with such simple tasks? All of these health risks, along with many more, are 100% preventable. I read a quote from a poet called Ogden Nash. He says that some tortures are physical, some are mental, but one that is both is dental. Dental anxiety is one of the most main reasons that people fail to see the dentist every year. Why save yourself the stress and preparation of going to see the dentist and practice proper dental hygiene on a daily basis? Dental hygiene is one of the most overlooked things on a person's daily routine until they are put in the dental chair and told how bad their conditions really are. You don't have to brush all of your teeth, just the ones that you want to keep. I appreciate you being here and thank you for listening.